Hi, friends. So there are four major participants who are involved in any healthcare system. The first is us, the patients. So whenever we are getting sick or we met with an accident, then we consult the hospital. So the second participant is the doctor. They'll give us care or health service, and we'll be providing the direct payment to the hospitals. And there are insurance companies also. In India, there is not. In India, it is not mandatory that every citizen should have a health insurance policy. But in foreign countries, they have made it as a rule that everyone should have their own health insurance policy in order to avail cheap and best healthcare services. So, if we have any healthcare policy, if we have taken insurance, then if we are consulting the doctor for some treatment or some surgery, we have to pay a certain amount, and our insurance provider they'll be paying the remaining amount. But if we are not having an insurance policy, we are supposed to pay the entire amount to the hospital. And then there is a fourth participant who is the government. It is the duty of the government to make sure that every hospital that we are consulting, they are following the hygiene rule to make sure that the hospital is adhering to every rules that the government has imposed on them, and they'll also check whether the health insurance companies they are acting as per the government regulations, right? So, as a CSE graduate, when we are when we are trying to incorporate our technological standards to healthcare sector, so these are the common issues that we'll be facing. For example, difficulty in de-identifying data. De-identifying data in the sense, normally when you must have seen some data sets from online, right, from the Kaggle website or somewhere. Mostly it will be Excel files that you must have seen. It'll have some patient name, their age, then their vital signs like the blood sugar level, pressure level, body temperature, etc. There, they have mentioned some patient details, right? So it will not be the details of an actual patient. They'll have masked the identity. So it is the responsibility of a hospital to make sure that patient's privacy is preserved. So they won't be uploading the patient data directly. They'll be masking the details connecting the identity of the patient. For example, our name or phone number, address, everything will be masked. Some duplicate identity will be mentioned there, and only then the data will be shared online, shared with other people, other researchers, etc. So when we are looking at the health data, we are supposed to do that, right? Identifying the data. So that is a difficult issue. And second issue is the interoperability issue. For example, say if I have to share a file with my friend, so either my friend and I will be having WhatsApp, Gmail, etc., or some other file sharing software. So using that, we can share the file easily. So this easiness comes because both me and my friend are having the same platform, same software, Gmail or WhatsApp or whatever. So everyone, we are having the same platform, the same base. So we are able to share and access files easily. But that is not the case when it comes to healthcare. Only some percent of the hospitals are digitized. When looking at the hospital that are digitized, for example, the Apollo group may have bought their software, their record management software from some X provider X, and the some other group, say the Kim's Hospital from Trivandrum, they must have bought their health software from some other provider. So the issue here is that these two softwares are from different providers, so they can't share files easily. So that is the major issue. They'll have their own formats and standards, and these people will have their own formats and standards. So it will be very difficult for people to share data. That is the main issue, the interoperability. So that is why there is a very slow progress in healthcare advancement in India. They'll be giving follow up, and if any disease is spreading, they'll give us vaccination so that it can be prevented even before so that we won't get attacked by that disease. And commonly, the hospital will also have some other duties like reporting the birth and death. So each hospital should send a report to the government, like in this particular day, these many people have given birth to these many babies in my hospital, and these many people have died. And also, they'll be treating people with morbidity and disability. Morbidity, in the sense, I met with a fracture, so I am supposed to take rest for 3 months. During the course of 3 months, the hospital will be taking care of me. Disability is a permanent illness that can cause that will be restricting the quality of someone's life throughout their entire lifespan. For example, if they have lost their legs, or if they have a stroke or some other deadly disease that can't be cured, so throughout the lifetime they'll be consulting that particular hospital and taking care. So these are the common responsibilities of any hospital. Thank you.